Jan, I'll be your family nurse practitioner student today. Can you tell me your name and your birthday?
Justin, March 23rd, 1998.
Perfect. Can you tell me today's date?
It is May 14th, 2023.
Perfect. And do you know where we are right now?
Fenton, Michigan.
Wonderful. And then do you know what brings you in today?
General assessment.
Okay. And then who is the President of the United States?
Joe Biden.
Perfect. Overall, your state of health appears to be fit. Your facial expression is normal for your age. You don't have any facial drooping. Your overall hygiene is well kept. Your cleanliness is within normal limits. There's no bizarre odors coming from your body or breath. Your posture is appropriate for your age. Just overall health appears well. So I'm going to take a look at your head and neck. So to begin, I'm going to put some gloves on, and I will be just overall inspecting your health, your head right now. So overall, your neck is midline, your hair is appropriate, there is no balding patches that I can see, or hair loss. Your facial expression is once again normal. There's no facial hair that's missing. So I'm going to take a cotton tip applicator and I'm going to inspect your head. I'm looking for any lesions, nevi, infestations, any scaliness or dryness. Just let me know while I'm touching if there's any tenderness. All right. Your hair is thick, the color is appropriate, your hair distribution is appropriate, there's no balding patches, no nevi, no lesions, no scalp scaliness, no bruising. Check the back of your hair. Wonderful. It's thin it's nice, thick, and soft textured. I'm going to take a look at your TMJ bones. So I'm going to have you open and close. Perfect. One more time for me. Good. Your TMJ bones are symmetric. There's no popping, clicking, or snapping when you open your mouth. Once again, your facial expression is normal. There's no loss of facial hair. Next, I'm going to take a look at your neck. So I'm gonna palpate your neck. Let me go back and palpate your head real quick. Let me know if there's any tenderness. Any tenderness with this?
No.
Okay, your head is normal, cephalic, and atraumatic. I'm gonna go ahead and take a look at your neck. So if you wanna lift your head up just a little bit. Perfect. Your trachea is midline. There's no lesions, no scrapes, no bruising, no discoloration or scarring on your neck. I'm going to palpate your lymph nodes and then palpate your trachea. So we've got the preauricular, postauricular, occipital, submandibular, submental, cervical. Go ahead and turn your neck to one side. We've got deep cervical and the other side. Deep cervical on this side, and then subclavicular. No lymph nodes are enlarged. They appear appropriate. So go ahead and lift up your neck. You're going to go up and down and then side to side. Good. And then go ahead and do one big circle with your head for me. Awesome. Your range of motion is appropriate for your age, for your neck. I'm going to have you lift your neck up again, and you're going to swallow for me. Trachea moves appropriately. I'm going to palpate the trachea from the front, and then I'm going to stand behind you. I can feel the cricoid bone, the trachea, and the rings. I'm going to move your trachea side to side. There's no lumps. Any tenderness when I do that?
No.
Okay. Go ahead and swallow again. The trachea moves appropriately when you're swallowing. There's no masses or lumps, and if there were, I would take a listen for a bruit. Okay, Justin, we're going to move on with your eye exam. I'm going to have you stand up, and you're going to be looking at the Snellen eye chart. Normally, the Snellen eye chart is 20 feet away, but this chart that we have printed out is for a 6-foot distance. I'm going to have you cover one eye at a time and read the lowest line that you're able to, and then we'll do it with both eyes.
D-E-F-P-O-T-E-C. D-E-F-P-O-T-E-C. DEFPOTEC.
Okay, I'm going to have you sit down and we're going to look at the Rosenbaum chart. You're going to hold this 14 inches away from your face, and we're going to do the same thing where you cover one eye, cover the other eye, and then with both eyes you'll look at it. So you're looking for the direction that the E's face. They're going to be facing up, down, left, or right. So read the lowest line that you are able to.
Right, down, up, down, right, left. Right, down, up, down, right, left. Right, down, up, down, right, left.
So from both of these charts, we are seeing that you're seeing 20/20 vision. So what someone out in the streets can see at 20 feet, you can also see at 20 feet. I'm going to have you stand up and look at this chart one more time for me. And then you're going to go ahead and tell me if the line is, what color this line is.
Green,
And then what color is this line?
red.
Okay, you can sit back down. I'm going to be wiggling my fingers extraocularly, and you're going to tell me if you can see them on both sides, one side. If you can only see on one side, let me know which side. Otherwise, just let me know that you can see them.
Yeah. Yeah. Mm-hmm.
Wonderful. Next, I'm just going to inspect your eyes. So your eyelashes are fanning out appropriately. There's no bruising, lacerations. Your sclera is white. Your pupils are round. You don't appear to be in any distress. Are you having any eye irritation?
No.
I'm going to palpate your lacrimal sac, so you're going to feel me touch right here and above your eyes. Let me know if there's any tenderness with it. Any tenderness?
No.
Your lacrimal sac does not seem to be enlarged, and you're not reporting any tenderness. Next, I'm going to just pull down on your eyelids, and I'm looking at the color of your conjunctiva. Conjunctiva appears pink. Look up for me. And then look down. Awesome. So your conjunctiva is pink and appropriate. There is no lacerations or hemorrhaging coming from there. So we're going to move on, and I'm going to shine a light into your eyes, and you're looking to see that your pupils are reacting equally. So go ahead and look at me. And again. And the other side. One more time, okay? Good. So your pupils are equal, round, and reactive. You have what we call perla. So now you're going to look at me and look behind me. And again, look at me, look behind me. So your eyes are moving appropriately. You don't have any ptosis or drooping of your eyelids, and your eyes move together as they are supposed to be. So you're going to go ahead and follow the direction of my pen light. Once again, I'm looking that your eyes move together, and they are, and that you're not having any twitching or drooping of your eyelids, and that your eyes aren't spastically moving, and those appear appropriate as well. So now I'm going to push the pen light closer to your bridge of your nose, just to make sure that your eyes congregate appropriately. And again, what I'm looking for is a lazy eye, which you do not appear to have. So I'm going to move on, and I'm going to shine this light in your eye. What I'm looking for is what we call a red light reflex. Before I do that though, I'm going to do one more thing. I'm going to have you hold this note card in front of one eye, and you're going to look at me, and then the other one. So I'm looking for any drooping with your eyelids, which you do not appear to have, and your eyes focus appropriately. So you're going to see a bright light in your eye. See the red light reflex, and then one on the other side. The red light reflex. Now I'm going to shine the light in your eye, and I'm looking for your fundus and the artery and vein. I'm looking for any hemorrhaging, just any fluid buildup, any connection either. So I'm going to get very close to you. My hand is going to be on your forehead. Open your eye for me. So I see the fundus and artery appropriately. I'm at about a 15-degree angle. And then again with the other side. And again, I see the fundus, artery in the vein. There's no hemorrhaging, lacerations. Everything appears appropriate. Okay, Justin, next we're going to be moving on to your ear, nose, and throat exam. So first I'm just inspecting the ears, making sure that they're at the symmetrical height. There's no lesions, bruising, or masses that I can see them. I'm going to palpate the ears now. Let me know if there's any tenderness. No cuts, masses, lesions, no bleeding or fluid. Your ears are appropriate. I'm going to have you cover one ear. I'm going to rub my fingers and you let me know if you can hear it, okay?
Yeah.
And the other side.
Mm-hmm.
Next, I'm going to be taking a look inside of your ears. So what I'm going to do is I'm going to pull the auricle back. I'm going to secure my my ophthalmoscope to make sure that I'm not hurting you. What I'm looking for is any foreign bodies, any hemorrhaging. I'm looking to make sure that your eardrum is gray in color as it is supposed to be and it's intact. There's a little bit of wax in this ear. Your eardrum is intact. There's no foreign bodies, no hemorrhaging, no fluid. And we're going to do the other side. Once again, I'm pulling that auricle back. There's a little bit more earwax in this one. Your eardrum is intact. There's no fluid buildup, no hemorrhaging, no foreign bodies. Next, we are going to do what's called the Weber and the Ryan test. So I'm going to take my tuning fork and I'm going to place it on the top of your head and you're going to let me know if you hear the sound equally or one ear better than the other. Or, feel the vibration.
Equally.
Okay, next we're going to move on to the Ryan test. I'm going to place the tuning fork on the bone behind your ear and I'm looking to make sure that air conduction is greater than bone conduction. I will be counting the seconds in my head and then I will let you know if it is greater and by how many seconds. So you let me know when you can no longer hear this from the bone. I'll move it to the ear with the U facing me.
I can't hear it.
Okay.
I can't hear it.
Okay, so air conduction was greater than bone conduction by 16 seconds. And we're going to repeat this on the other side.
I can't hear it. I can't hear it.
Okay, so air conduction was greater than bone conduction by 14 seconds on that side. You're going to move on to the nose. So I'm looking at your nose. It appears to be midline. There does not appear to be any deviation, breaking, bruises, any fluid coming out of your nose, any rhinorrhea. I'm going to palpate your nose. You let me know if there's any tenderness, and I'm feeling to make sure that the cartilage is intact. Any tenderness with this?
No.
Cartilage appears to be intact. The nose appears to be midline. I'm going to take a look into your nose, and I'm looking to make sure that the mucosa is pink. There's no fluid, there's no lacerations, there's no masses or lesions that I would need to look at. Let me just, let me turn this on. The ahead and lift your head up. Mucosa is pink. There's appropriate nasal hair. There's no masses or lesions. There's no exudate, and it appears intact. I'm going to palpate your sinuses. You let me know if there's any tenderness with it. Any tenderness?
No.
Sinuses do not appear tender. I'm going to shine a light into your sinuses. Let me find the pen light very quickly. I'm looking for illumination to make sure that sinuses are not fluid filled. Those sinuses are appropriately illuminated. Now have you open your mouth. And I see proper illumination there. And there. There's no fluid buildup. I'm going to have you plug one side of your nose and sniff, and the other side. Okay, so the left side appears to be stuffier than the right side. Would you agree?
Yeah.
Okay, I'm going to move on to your lips and your throat now. Overall, your lips are intact. There's no dryness or scaliness. They're appropriate color for your race. There's no lesions or masses growing on them. I'm going to put a tongue depressor in your mouth, and you're gonna open up your mouth and say ah. What I'm looking for is your gum color, your overall dental hygiene, any masses, cuts, scrapes. And then I'm gonna make sure that your uvula rises appropriately and that your palate is intact. Go ahead and say ah. Okay. Tonsils do not appear enlarged. You seem to have one carie on the right side. Overall dental hygiene is appropriate. It looks like on the left-hand side you have part of a tooth missing. Your mucosa is intact. Your tongue is appropriately colored. There's no patches or thrush on it. Your gums are not bleeding or receding. The dental hygiene is overall fairly appropriate. I'm going to have you stick out your tongue, and I'm going to palpate it. Move it side to side for me. Good, and then stick it out once more. I'm feeling for any masses, looking for any masses, and making sure that once again there is no thrush or anything on it, but that appears appropriate.